Hello, this is the HHS meeting for May 9th. We will now start with the Pledge of Allegiance. Thanks, Julie.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I need an adoption of the agenda, please.
Romano adopts the agenda.
Support Van Sickle.
So Commissioner Romano made the motion and Commissioner Van Sickle supported. Thank you. Do we have an approval of the minutes, please? Oh, I'm sorry, we should vote. Let's vote.
Motion passes 12-0.
Thank you.
Matusik moves approval of both sets of minutes.
Support from Kraft.
Thank you. Commissioner Matusik moved and Commissioner Kraft supported. Are there any discussion? Thank you. We'll vote. We have a joint, we will be having the Health and Human Services meeting now, and we'll go to the Internal Services Committee afterwards. And Records and Public Safety. Right now, we'll be going to public participation on anything related to the agenda of today. If anyone wants to speak for 3 minutes. Once, twice. We will close that now. We have a veteran report. Laura, do you want to stand up now, please? Thank you so much.
Madam Chair, I'd like to make a motion to receive and file.
Thank you.
Is this on?
Commissioner Farrington made the motion, and was it Commissioner Van Sickle supported?
Sure.
Okay. Commissioner Romanos supported, thank you.
Sure.
Go ahead, Laura, thank you.
Is this on? Yep, it is. Okay. So just an update for our first quarter, January through March. Our last discussion, which I believe was January, February, we talked about changing some of the format and incorporating zip codes. So that started, we're starting to collect that on the 1st of April. So on the next quarter report, we should see zip codes, and we'll get to kind of give you that data on, how many people are from your jurisdiction, your area. One thing we did add to change this a little bit, which we started at the first quarter, was number 2, which is the total number of people contacted. So this was just for the first quarter. Now, there's a huge difference in numbers, but I would say almost fully staffed. And for the first quarter, I was fully staffed, and we're counting all contacts with email, phone calls, since the younger vets are now doing things more electronically versus, do I need to come in? I can just fax you the stuff or email it to you. And we do use encrypted email also. So that's something different that we're showing here. The county burial allowance we started doing last quarter, or actually just a month ago. It's not been a whole quarter, it's just only been a month. So that's going to be on Wednesday's agenda to fix some of those little minor issues. But we are doing that, and that's not on this report, the change, because the first full quarter was still using the old amount, the 300 versus the 500. And other than that, as far as tax season's over, hoorah. So the total number of returns as of last week, we did 2,116. So that's a lot out of 7 locations. And we are opening an 8th location for next year. So any questions?
I see no, Commissioner Matusek, please.
Thank you, Madam Chair. The last couple of meetings, we talked about using some of the ad money to do some direct mail, exploring some direct mail stuff. We made any progress on that?
Oh, the direct mail has been going on. It's been 7,000 per month because they're sending out 60. And if all 60 went out in 1 month, I can't handle that.
Right.
I can't handle the lash of
Right.
what's coming after all those calls. So they're actually sending out 7,000 per month.
Great.
And that's been going on now for about 2 or 3 months. And we know when they're getting them because our intake and phones have tripled. So, but yes, it's going on. The flyers went out. It's the same flyer as the bulletin board, but on the back side of the flyer, it shows our benefits and what they could be entitled to, and please call us.
Great. Glad it's working.
It is, and actually, when you really look into, I'm thinking, boy, that's got to be flipping expensive. And it wasn't. Honestly,
Right.
it wasn't. Compared to when you're sending out 60,000 and it cost me less than 60,000, and they did all the work, they did the
Right.
printing, they did the labeling, I'm like, I'm good.
Yeah.
Well worth that price because I didn't have to do it, nor did my staff have to spend
Right.
weeks doing that. So it was awesome.
Well, I'm glad.
And we are seeing the results of that.
Good. Thank you, Madam Chair.
Thank you, Commissioner. I think we'll take a vote on this now, please. Yeah, motion to refuse already passed. Laura, I'm glad you're having all this reception back for your office. That's great. I think we're finished here.
I will see you on Wednesday.
Thank you so much.
Thank you.
Motion passes 12-0.
Thank you. Ernest isn't here. I see, is someone stepping in for him?
Who is that bearded guy?
I forgot, I'm sorry, I forgot your name.
Good afternoon, Commissioners. Joseph Cook, Division Director with Community
Oh,
Services,
great.
here for Ernest today. Nice to see all of you again. It's
Thank
been
you
a
so
couple of
much.
years since I've had a chance to come up here. So we have 3 items under number 7 for you. The first one is our...
Joseph, just a second, please. We're going to have to, I'm going to ask for a motion to receive, recommend to full board.
So moved by Nard.
Okay, thank you. So Commissioner Nard made the motion, Commissioner made the support? Support. Okay, don't, we'll go to,
Chair, I'd like to amend this to move A through C.
I'll support that.
Yes, yes. Thank you. All right. Joseph, thank you. I haven't seen you in a while, so it's
Yes.
good to see you. Thank you.
Do you...
Okay, continue, please.
Okay.
Thank you.
I brought with me Program Manager Stephanie Burgess, who oversees all of our HUD programs. She was going to give you some additional information on the action plan and answer any specific questions that anybody had. So
Great, thank you.
Dumped it on you, Steph.
It's okay. It's what I do, right? Well, good afternoon, and like Joe said, it's been a few years since I've been here, so it's a good opportunity. So Macomb County annually receives federal funding through the U.S. Department of Housing and Urban Development. It's the Home Investment Partnership Funds, the Community Development Block Grant Funds, and the Emergency Solutions Grant Funds. The county is required to submit an annual action plan before the funding is awarded, and the annual action plan includes a concise summary of the activities that will take place with those dollars. For this annual action plan, we did have to use estimated funding. It's based off of the 2021 annual actual allocations. They still haven't announced the 22. I checked right before I left to make sure. So what we were able to do is we were able to move forward with estimates as long as we included how we would handle any funds that were an increase or decrease in funding. So with that, I just want to direct you to it's a short PowerPoint, and if we could move to the next slide. Is it going? Are you doing it, or? Okay. All right. I wasn't sure if someone else was doing it. Sorry. All right. So what it is we have a 5-year consolidated plan. The 5-year consolidated plan runs from 2019 to 2023. And the 22 annual action plan is actually year 4 within that plan. And as I mentioned, the funding sources for those include, let me go back here. The funding sources included in that plan are, of course, CDBG. And what we could use those funds for are public improvement projects and services designed to benefit low to moderate income persons, prevent slums and blight, and to address urgent needs. The service area for the CDBG funds in the Macomb County Annual Action Plan includes the 20 units of local government that do not receive funding directly. So Sterling Heights, Clinton Township, Warren, St. Clair Shores, and Roseville all receive their own CDBG funds. We can't use our CDBG funds in those areas. Also, the city of Memphis opted out of this program, so we're not able to use those funds in that city. The funding limitations with those is we have 15% maximum for public service and 20% for administration. Home investment partnership funds, those are used for housing-related activities. The service area for those includes the urban county communities. And then also Roseville, Sterling Heights, and Clinton Township joined the Macomb Home Consortium back in 2005 to get more of those dollars in Macomb County. They're not able to get those dollars on their own, so being part of the consortium, we're able to bring more money for affordable housing into Macomb County. Funding limitations are 10% for admin, and then there's a 15% requirement for community housing development organizations, and we'll talk about that a little bit more. The emergency solution grant funds, those are used for homeless activities. We are the only recipient of those in Macomb County, so we use those in all of the cities in Macomb County. And there's a 7.5% admin cap, and then there's also a cap on street outreach and emergency shelters that can exceed 60%. There we go. So what is a consolidated plan? The 5-year plan is done so that we can plan out the goals and objectives for the use of those 3 sources of funding. We do that along with the cities of Roseville, Sterling Heights, and Clinton Township. We establish goals and objectives, and then we carry out those goals and objectives in the action plans. The grantees then report the accomplishments in a CAPER. So that's the Consolidated Annual Performance Evaluation Report. And as I stated, the urban county is comprised of 20 units of local government. We also talked about who is also as part of the Macomb Home Consortium and that Memphis opted out. We act as the lead agency for the Macomb Home Consortium, as that we then are in charge of drafting the consolidated plan. Roseville, Sterling Heights, and Clinton Township conduct individual non-housing related public meetings as part of that. And then we share consolidated goals and objectives. So those have to be pretty broad to cover all of those areas. So you'll see here that any activity that falls under our annual action plan has to address a goal and objective that was included in the consolidated plan. Those are make available appropriate housing, improve public facilities and infrastructure, address the needs of homeless and at-risk families, provide and expand human services, foster economic development, aid in the prevention of slums and blight, and expand comprehensive planning management capacity. Now, due to our limited funding, we can't address each one of those goals in every plan, which is why one plan isn't going to be the same as the next. They're going to change every year. So the steps for completing that consolidated plan, we assess prior year accomplishment, we engage local stakeholders, we analyze data, then we establish those goals, we draft the consolidated plan, we have a 30-day public comment period. The consolidated plan did go before the Board of Commissioners back in 2019, and then we submitted that to approval for HUD. U.S. Department of Housing and Urban Development. So that brings us to our 2022 annual action plan. I'm going to give you typically what we do with the Community Development Block Grant Funds. 20% goes for program administration, wages, supplies, advertising, office rent, everything that you can imagine that we need to run the program. 25% typically goes for housing rehabilitation, 15% for public services. Now, the public services, the nonprofits apply through a public request for proposals Those are submitted to my staff for review for eligibility, but we believe in local control. So each community is provided with an allocation for public services, and each one of those communities hold their own public hearing, and they determine what's best for their community. So we determine eligibility, they determine what's best for their communities. Then about 45% goes towards public facility and improvement projects. What we've done is we've moved to a competitive process for that. That gave the communities much larger awards to work on better projects. That has been very successful, so it's a competition, fortunately. We haven't had to turn anyone away yet. So every application that has come through, we have been able to fund. The Emergency Solutions Grant now, those activities are based on consultation with the Macomb County Continuum of Care. And then the Home Investment Partnership activities are determined by the members of the Macomb Home Consortium. Now, as I was stating earlier, the allocations, the actual, were not available at the time that the plan was posted for public comment. For contingencies, we stated the following. For CDBG, any increase or decrease would be applied to housing rehabilitation. If funding is decreased, though, and we're not able to stay within the cap, then we would have to reduce administration public services proportionally. For the Home Investment Partnership Program, all activities would be proportionally increased or decreased, and the same would be for ESG. So then that moves you over to the plan that was included in the agenda. And you'll see that the funding that's included for CDBG, we're putting an estimated allocation of $1.9 million, 50,000 of estimated program income. In the prior year resources, if you've noticed that at 515,000, that came from the Neighborhood Stabilization Program back from 2008. We have got prior program income from houses that were supported during that time that have sold and recaptured money. We were able to turn that into CDBG funds, and that enabled us to fund all of the public infrastructure and improvement projects that were submitted by the communities through that competition. So we had 11 community applications, and that came from 8 communities: Centerline, East Point, Mount Clemens, Fraser, Shelby Township, City of Richmond, New Baltimore, and Macomb Township all submitted applications for public facility improvement projects. We are able to fund all of those. The remaining of the CDBG will go to housing rehab and administration, and then we have public services. We have 9 nonprofits that we are funding through that program as well. The Home Investment Partnership, about $1.6 million. We have estimated program income combined to almost $1.8 million total. 10% will go for admin. We're going to go with housing rehab for about $860,000 estimated. That'll give us about 15 homes that we can work on. And then we have 700 and around 70,000 that'll go for community housing development projects. We will go out for an RFP for that. And then our Emergency Solutions Grant, that's about $160,000. We have activities administration, rapid rehousing shelter operations, and required HMIS reporting. Those will go out for an RFP later. Right now, there was such a large influx of ESG funds through the CARES Act that we're letting our partners absorb those dollars and spend those dollars, and then step back and we can reassess what's needed and who can absorb those additional ESG dollars. So with that, if anyone has any questions.
Much. Commissioner Matusik, please.
Thank you, Madam Chair. We do a lot to make sure that if folks are in an emergency situation, we figure out ways to shelter them. Can you speak more about what we do to actually develop housing that's affordable?
I can. We have worked with, and that's where our CHODO's coming in, those community housing development organizations. We actually have some dollars into the Aaron Park project that is over in the city of East Point. Some of our home dollars went in there. We have also funded many homes through Habitat for Humanity. We have a number of scattered site rental through Community Housing Network. Some of the dollars that I don't know if you're familiar with Grafton Townhomes, that's also in the city of East Point. We have some funds in there. And then Oakwood Senior Housing, actually that was completely funded with NSP and home dollars. and that's also in the city of East Point. Right now with the housing market the way it is, I can tell you it's extremely challenging because we have to be able to go out and identify housing that someone else isn't taking right now, and it's really hard. It's extremely difficult. And then to be able to get the housing to a price that we can't sell homes to anyone has income more than 80% EMI. So if that's a one-person household, that's about $44,000. So it's extremely difficult, but that is definitely a mission that we have, and we have some really great partners in Community Housing Network and Habitat for Humanity. Those are our two CHODOs right now. Not that we're, that we close the door to anybody else, but those are the two agencies that we've worked with the most.
Thank you.
Welcome.
I don't see any other speakers. Thank you very much for that great explanation, and we will go for a vote now.
Thank you.
Madam Chair, can we hear about the other two? This was a motion to incorporate all three things.
Yes,
I would like
yes.
to hear about the other two.
Thank you so much.
Thank you.
Sherry, no, Stephanie. Stephanie, are you, oh, okay. Yes.
Sheila Cote.
Sheila,
I'm
yes.
the Division Director for the Office of Senior Services. Good afternoon. This item is fairly straightforward. It's asking to split a revenue line between federal dollars and private pay. I believe it's related to the veterans payment for our adult day program that we need to shift those dollars over to that line item. Any questions?
Yeah, they're on the A. They're on the first one. Go to A.
Thank you, Madam Chair. Regarding the budget amendment for the adult daycare services, how many veterans does this actually serve?
It varies based on the census. I believe that last count we had 3 veterans that were participating in the adult day program.
Okay,
Yep.
so the $65,000 is not inclusive of that, of the 3? Or
It is inclusive. That's correct. I think that the issue was that the Veterans Department was behind in payments, and so it was difficult to recoup those dollars for the cost of the adult day program for those individuals.
And do they participate in this like on a weekly basis, or
Some
is for a
daily,
year?
some 3 times a week, some twice a week. We're pretty flexible in terms of the scheduling, so it's up to them and their caretakers as to whether or not they want to participate. Our adult day program is dementia specific, so part of the admission criteria is that they're suffering from some dementia-related illness.
So they would have to be diagnosed
Correct.
first, right?
Yes.
Okay, thank you. Thank
You're
you, Chair.
welcome.
Thank you very much. I don't think I have any more speakers. Do I have any more speakers? I think I still am not there. Okay, Commissioner Matusek.
I'm a little confused about decreasing the private pay revenue. Does that just mean we don't have as many people as we anticipated doing private pay?
Correct.
And so
correct.
we're just moving that forecasted revenue into this other federal account?
That's my understanding, yes.
Okay, thank
Yeah.
you.
You're welcome.
That was my question.
Thank you, Commissioner. Commissioner Chair Brown.
Thank you. Nice to see you today.
Nice
Thank you
to
for
see
coming
you.
up.
Thank you.
This program, does this anything overlap? Do they have to all be veterans? Are there any,
No, we have AAA funded participants. We also have private pay participants. So we get so many units from AAA through their grant to support individuals that need that daycare. And then we also have private pay individuals that come in and their caretakers or someone else in their family is paying us to provide that. Yeah.
where would someone get a list of referrals for home health? I had a constituent request some assistance he's receiving chemo and his wife's in a wheelchair, needs full care 24 hours a day, and he's in a bad way, and he's not able to look after her. So I'm trying to find some referrals that he could possibly call upon to
They
do
could
that.
certainly call our office. We have sort of a call center, so when seniors are in need of assistance, like you're talking about, they can call our office, and we can direct them to the right location where they can ask for services. Some of those services are provided through AAA, some are provided through DHHS, like Home Help is a service that's provided through DHHS.
If they call the number, they'll get a list. It'll be easy for them to get what they're looking for
Yep,
and manage.
Yep, our call center staff have lots and lots of resources that we refer people out to.
There's a lot of resources we have available to them, and having one point of access is really key, so I appreciate you helping out.
Yeah, I agree. It's confusing because a lot of different agencies provide different services, and for a senior to try to figure out what direction to go, it can be very overwhelming.
To many of the
confusing.
new commissioners, you don't appreciate the value that we have in our office. It's available to you as commissioners to help people that you don't think you don't really know where to go. And even if you don't really know where to go, call an agency that'll be able to help them.
Absolutely.
Like the Senior Services Department.
Yep.
I mean, I one time received it from my own grandmother many years ago, a list
Yeah.
for referrals, and it certainly changed a lot since then.
Yep.
But I'm glad you're here, and I'm glad for the work
Thank
that you
you.
do.
Thank
And,
you. I appreciate
I
that.
appreciate it. Thank you.
Thank you.
Thank you, Madam Chairwoman.
I think we're finished.
Okay.
Thank you very much.
Thank
And
you.
we'll take a vote now. Oh, great. Okay, more to the party.
Thank you again, Madam Chair. The third of our items on the agenda today is a letter C, a simple budget amendment for our COVID Emergency Rental Assistance, or CERA program. We're requesting an amount of $71,850 be moved from personnel costs to operating costs, which will result in more direct assistance for our constituents.
Well, that's always needed and helpful, because we have a lot of situations, I know that. People keep calling me with situations, and I keep trying to send them to people, and hopefully that works out. I have no speakers here, I'm pretty darn sure. And did I miss you, Commissioner? No. Okay.
I know I'm speaking a lot today, but
No, that's fine.
Thank you,
That's good.
Commissioners.
I think we will now take a vote, and thank you very much. We will now go to Records and Public Safety.
Thank you, Madam Chair. Records and Public Safety Department, item A is budget amendment, Community Corrections, fiscal year 2021, 2022, Community Corrections Grant Fund, $35,000. Barb Caskey is director. I need a motion to recommend this to full board.
So move, Hall.
Support Van Sickle.
It's been moved by Commissioner Hall, supported by Commissioner Van Sickle. We have Barb Caskey up.
Hi, how are
Ms.
you?
Caskey. Good, go ahead.
Hi, I'm here today to request a budget adjustment for the addition of $35,000 from Michigan Department of Corrections to our annual budget, which would allow for the remainder of this fiscal year to fund one FTE for an office assistant. This is in addition to the regular budget that we receive from MDOC, and then would continue into their budget for the next fiscal year and onward.
Thank you. Commissioners, do we have any questions? I see no speakers. Please vote. That was nice, wasn't it?
That was, make it easy, make it easy. Thank you.
You're welcome.
Motion passes 12-0.
Thank you. Item 9 is public participation. This is the opportunity for public participation for those who wish to speak for a maximum of 3 minutes on any issues. Do we have anybody in the audience who would like to speak on any issue for 3 minutes? Vicki, do you have anything you want to speak on for 3 minutes?
No, I'm good, thank you.
You sure? Nobody else in the audience? I'm going to close that portion of it. Last one is item number 10, which is commissioners' comments. Any commissioners who wish to comment? I'm looking. Show me your hands if you'd like. Unless, Commissioner Kraft, do you have a date tonight that you have to hurry to or anything?
4 o'clock.
Oh. Commissioner Kleinfeld?
No, you just asked
Okay, so we have no commissioners who want to speak. Last item is an adjournment.
Motion to adjourn.
Nope. Commissioner Mai, moved by Commissioner Mai, supported by, Commissioner Hall felt bad. Commissioner Mai made the motion, Commissioner Hall seconded it. This meeting is adjourned. See you all tomorrow. Thank you. Motion passes 12-0.